Out the Lifeline, a mission to families, opioids. I had the pleasure of speaking to Tori yesterday from Nigeria, where she's on a sabbatical from her position as training coordinator for Hold Out the Lifeline, a nonprofit that works to enable its partners and communities to address the holistic health of families in South Carolina. After receiving a bachelor's degree from the University of South Carolina and a master's degree in pharmaceutical and biomedical science from MUSC, Tori chose to follow her passion of commitment to community outreach, education, and empowerment. I found my conversation yesterday with Tori to be fascinating, and I'm sure that you will be blessed by her presentation today. Tori?
Thank you, Wendy. That was the perfect introduction to me, for me, and by far the best that I have had yet. So thank you so much. Kim, may I have access to share my screen? I do have a presentation that I would like to share today.
Yes, you should be able to share.
Okay. Thank you. So I'm going to bring up my PowerPoint presentation, and I hope that you ladies find this very fascinating and interesting enough to share it with other individuals. So I just want to do a temperature check really quickly. If you can put, for those of you that have access to chat and can chat safely, give me one word to tell me how your day is going so far in the chat. Give me one word. Okay, I see them. I'm loving it. Wonderful. So good. This is the way that I want you all to communicate with me. I definitely want this to be an opportunity for you to chime in, so that I can know exactly what you know, what you don't know, and also for us to make sure that I am not moving too fast, too slow, or whatever the issue may be. So I noticed that someone said they cannot see me. So I'm going to assume that you may need to scroll over if you cannot see me, but Kim is on it. She has spotlighted me as the speaker, so I should be on your screen right now. So good. Thank you all for doing that check-in. I am glad to see that everyone is blessed and wonderful, awesome. I think I even saw golden, which is beautiful. So I am thanking God for all of you all today. Okay, I'm going to bring back up our PowerPoint. So just to, like I said, I wanted to do a temperature check to make sure everyone could chime in. So again, today we are addressing the opioid epidemic in a faith-based setting. Again, I am with Hold Out the Lifeline. My name is Tori West. Hold Out the Lifeline is a nonprofit organization that works with state agencies and faith-based agencies to make sure that we are being advocates for health in our faith-based setting, as well as doing technical support, education, and training. And the mission of Hold Out the Lifeline is to enable our partners and our communities to address a holistic health of families in South Carolina, using the motto, each one can reach one. So you've all heard that if each one can teach one, we all would be sharing a wealth of information and no one would perish from a lack of knowledge, right? And so the question that I have for you today, and you can again feel free to chime in the chat box. The question that I have for you today is, what is the role of the faith-based community when it comes to the opioid epidemic? Is there a role for the faith-based community, and what do you believe the role is? So I'm going to give about 20 seconds for those of you that want to chime in for this question. What is the role of the faith community when it comes to the opioid epidemic? So I'm going to pull it down just so we can see. I'll give you 20 seconds for those of you who are interested in chiming in. Support and education. I like that, Kathy. Yes. Deborah, our role is to support. Yes. Advocacy. Caring, to give emotional support. So support is a common theme. Advocate for better mental health and addiction rehab. Jody, that is really good. Becoming informed to and where to send others. So yes, resources in the community is important. Giving a message of hope. Wonderful, Lynn. Thank you. Offering comfort and healing, education for our congregations, and welcoming folks with special needs, as well as awareness and advocacy, and to educate ourselves, advocate, and support. Yes, all of that is great. And that is exactly why we are here today. So good. I'm going to go ahead and bring back up the presentation. Here we go. So my goal today is to share exactly what we know, statistics for both the US as well as South Carolina, and to establish the role, our role as faith-based organizations in the opioid epidemic, as well as, of course, educating you on behalf of Hold Out the Lifeline, a mission to families, as well as the South Carolina Department of Health and Environmental Control with the Bureau of Chronic Disease and Injury Prevention. The purpose in educating about opioid prescriptions in the treatment of chronic and non-pain relief is for us to make sure that we understand that there are alternatives to opioids. As we go through this presentation, again, I will give you data, we will share stories, and we'll also talk about the ways that we can help and ways that we can educate ourselves and our community. So the first is, what is an opioid? I don't think that many people recognize that there are classes of opioids. So for example, there are 3 classes of opioids that include prescription, synthetic, and illicit drug opioids. So the most common that you may have heard of are prescription drug opioids. And prescription drug opioids are opioids that are simply prescribed by your doctor to treat moderate to severe pain, but it also has some serious side effects that could go along with it. Knowing that there are common opioids that you may have heard of, so things like Oxycontin, Vicodin, morphine, and methadone are the most common opioids that you may have heard of when it comes to prescribed opioids. Your synthetic opioids, however, are things like fentanyl, which is a synthetic opioid pain reliever, and in many times can be more powerful than other opioids, and is really only approved for treating severe pain. So things like pain from cancer. And then the final class of opioid is heroin. And so heroin is your illicit opioid. This is your illegal drug that many people may be familiar with, but not familiar with it as an opioid. And so heroin is an opioid, and it is used to people are increasing their use of opioids. And I'll bring up again the data. What we do know is that since 2014, the opioid, as far as heroin, has increased as we have begun to crack down on prescribed opioids. And so where heroin had taken a nosedive into the number of people that were using it, we find that as we have begun to put policies into place so that people are no longer abusing prescription opioids, that the heroin use has increased amongst everyone. So there's not a specific race, not a specific gender, definitely not a specific income level. We notice that it is increasing in men, women, all age groups, and all income levels. So again, those are your 3 classes of opioids that you may be familiar with: prescription, synthetic, as well as your illicit opioids. What we know, The amount of prescription opioids dispensed could quadrupled since 1999, but we know that individuals who have been prescribed opioids over the years have not reported a change in their pain. So Americans are being prescribed stronger pain relievers, but are reporting their pain to be the same as if they were taking regular pain relievers. And since 1999, more than 165,000 people have overdosed from prescription opioids, with nearly 2 million people who either have abused or were dependent on prescription opioids in 2014 alone. We also know that here in South Carolina, I say here as if I'm still in South Carolina when I'm actually in Nigeria, but I will be coming back home to South Carolina very soon. And so here in South Carolina, we know that 5 million pain reliever prescriptions are filled every year in South Carolina. And from the last census that we had, not the 2020 census, but 2010, because we don't yet have the data from 2020, from 2010 census, there were only about 4 million people, a little bit more than 4 million people residing in South Carolina. So if you do the numbers, if 5 million pain reliever prescriptions are filled every year in South Carolina, that's more than one for every person in our state. So a lot of pain relievers are being prescribed. We also know that 80%, which would be 4 out of 5 heroin users, started with using prescription pain relievers, as well as 25% or 1 in 4 of our teens in South Carolina have misused or abused a prescription drug at least once. So we're recognizing that there are issues within our state. We also know that as many as 1 in 4 patients receiving long-term opioid therapy in a primary care setting struggled with opioid use disorder, meaning they are abusing opioids to a point where it has become an addiction. What else do we know about the data? From data from 2018, we know that over 1,100 drug overdose deaths were reported, which was up 10% from the previous year, as well as in 2018, over 800 opioid-involved overdoses were reported, deaths were reported, which was almost up 10% as well from the prior year reported. So the numbers are increasing at a staggering rate. A 10% increase over anything is a huge number. And so the question that we usually get is, well, when do I know if a prescription has become a problem? And the answer is when it becomes addictive. Everyone is different. Everyone's tolerance is different. Everyone's chemical makeup is different. And so what we want to make sure is that we recognize that more than 191 million opioid prescriptions were dispensed to American patients in 2017. And of course, the most common drugs that are involved when it comes to overdoses and death would be methadone, oxycodone, also known as Oxycontin, as well as hydrocodone, as well as known as Vicodin. And so again, we want to make sure that people understand that addiction is different for everyone. And I have an example here. I'm going to play this video where a young lady named Brenda talks about her addiction, and then I will expand on it from there.
We were driving to the supermarket, and as we entered the parking lot, a car ran a stop sign and completely T-boned us. When I was first prescribed my prescription pain meds, there was nobody to tell me that these have a really high potential for addiction. How can I be addicted? I get these from my doctor. It kills your soul and it makes you feel worthless. We were driving.
So in hearing Brenda's short story, she mentions how she couldn't understand how she could be addicted from something that her doctor prescribed her. And so anyone who takes prescription opioids can become addicted. That's what's most important in recognizing. And that once addicted, it can be hard to stop. Brenda found herself addicted to opioids based on a car accident. She was prescribed some pain relievers following a car accident. And after a short stint of taking those pain relievers, found herself addicted to it. In 2016, more than 11.5 million Americans reported misusing prescription opioids in the past year. And so taking too many prescription opioids can stop a person's breathing, which also can lead to death. And so this is the problem that we are having with opioids. The individual may be prescribed opioids for pain, which we understand that people do require pain management. And from there, not understanding the side effects or the consequences of taking opioids, find after a short time that they become addicted. And then once becoming addicted, things like building tolerance happens. You're needing more pain relievers to get the same pain relief. And eventually that can lead to a person to stop breathing. And that's the danger with opioids. So I talk a little bit about side effects. And so the two terms that I want you to remember are tolerance and physical dependence. And so when we talk about tolerance, that simply means that you need more of the same medication for the same pain relief. So a person may start off taking the prescribed 2 every 8 hours or whatever the prescribed amount may be, to needing 3 every 8 hours or 2 every 4 hours for the same pain relief that they were feeling in the beginning, as well as the physical dependence, which means you have symptoms of withdrawal when the medication stops. And so those symptoms of withdrawal can be severe. And to also let you know that withdrawal can be life-threatening as well. So making sure that we are paying attention to the side effects of not only withdrawal, but also the side effects of prescription pain relievers, opioid pain relievers, including increased sensitivity to pain, constipation, nausea, vomiting, dry mouth, feeling fatigued and dizzy, confused. Depression is a side effect. You may experience itching or sweating when it comes to withdrawals, as well as results in lower or reduction in sexual desire or reduction in energy, as well as a reduction in strength. These are all side effects of opioids. I'm going to introduce you to Mike as well. Mike has a similar opioid story.
I was given a prescription opioid pain medication that lasted a lot longer than the pain itself. At the time, I didn't understand the dangers of these drugs, and within only a few months, I was completely addicted. I lost everything. I had to leave school and stop playing sports in college, and I started to watch my life slip away. These drugs are addictive. One prescription can be all it takes to lose everything.
So when we look at Mike, Mike was an individual who also found himself addicted to pain relievers. And so we want to talk about the alternatives. And so before I talk about the alternatives, I noticed that there are some questions. So let me follow up with these questions just to make sure that I'm not missing any. Let's see. So I see that there's a question about Adderall. Is Adderall an opioid? No, Adderall is not an opioid. Let's see. Did I miss any other questions?
I don't think so. I think that was.
Okay. Okay, so no, Adderall is not considered an opioid. While individuals can become addicted to Adderall, that also is a substance use disorder for individuals who may be dealing with some type of substance use, but it's not considered an opioid. That's a good question, Diana. Thank you. Okay. So going back to what are the alternatives? Knowing that there are alternatives and that you have other options is the key to fighting this epidemic. And so educating others and considering alternative ways to manage their chronic pain without prescribed opioids. You have things as far as non-opioid pain relievers, such as Tylenol, Motrin, and naproxen, which naproxen is, by the way, the brand name for naproxen. You may have heard of naproxen, but not necessarily naproxen. You also have different things like your antidepressants and anticonvulsants, which again can also benefit individuals who are experiencing depression and seizures. Other ways to manage your pain can include exercise. So when it comes to exercise and physical therapy, as well as cognitive-based behavior therapy, which basically changes your thought pattern and your behaviors that are related to your pain. And so some of these options may work better and have fewer risk and side effects than an actual prescribed opioid. So the question that I have for you is, how do we change the picture in South Carolina? What can you do in your own home to reduce the opioid epidemic? And what is the role of the church? So this again is a time that I want to check the temperature based on the information and the data that you've received so far. What do you think is the role of the church, which you guys did a good job answering that one, so you really don't need to answer that. But what can your role in your home be, and how can we change the picture in South Carolina? So I'm going to stop sharing for a moment to give you all an opportunity to share.
Hi. One way to address the problem in South Carolina is the poverty level and the health care level and the mental health care level. We're really low. We're at the bottom of the list for statewide public health assistance. And I was just reading in the paper today, they're thinking of basically dismantling DHEC, which all they probably need is more experts on their staff, not appointed by, the legislature, but that are doctors and experts in their field, and they need more money. I think it's such crime that our legislature is so shy about spending money on things that benefit the citizens of our state. They get a lot of pressure from anti-tax groups, and they don't realize that the purpose of government is to bring relief to its people. And that's the only purpose for it. So, I don't know how you bring relief without money and expertise, both of those things. You can't be having mental health and other health agencies being run by non-doctors. You shouldn't have that education oversight committee run by non-teachers. And
Yes.
so it just goes on and on what could be done to make our state better in health generally. Most people who are in opioid abuse have a mental health issue. And if that could have been addressed, why would they would learn, that opioids are a terrible way to handle anything that you have going on with you. That's all I got.
Absolutely. Those are some great points. The two that I want to point out specifically, again, is focusing on funding mental health, because abuse is a mental health crises. And so
Yes.
all of this starts with mental health. I noticed that Maureen said, educate, educate, educate. What you all are doing today, it is my prayer that you take this information to your legislators and educate them on the importance of funding mental health, because I don't think everyone understands that abuse and opioid abuse all fall under mental health. Most of the time, we only think about depression or anxiety when it comes to mental health, but not an individual who may be abusing alcohol or opioids or another type of drug as well. Carol says being very careful with prescriptions. Absolutely. That is a great point. So making sure that if your doctor is prescribing opioids, that you honestly have a conversation with them, right? I know sometimes we just take what our doctor says, and my doctor says I need 3 days of opioids, I'm going to take it. Well, really, is your pain that chronic? You can ask, is this something that I need to take? Sometimes they'll even say, if you feel like your pain level is high, then take this. So not necessarily just taking it to take it. Linda says to become aware of significant legislation and take advocacy action. Absolutely, advocacy is key, Linda. Understand about mental health. Yes, Patricia, that is a key. And I'm actually going to give you all an opportunity in just a moment if you are interested in understanding more about mental health, as mental health is something that Hold Out the Lifeline also does address. Continuing to advocate for the appropriate policies with legislators, yes. Bringing awareness to the crises, absolutely, Carol. More discussion in churches. Catherine, you are a saint, yes. To even have open and honest conversation in the faith-based setting about addiction, about mental health overall, not just addiction, but to address mental health in a faith-based setting can be key to helping a lot of us address this issue. And then Kim says, I think we could talk personally with our own doctors to make them aware of our overall concern. Absolutely. Folks have about the easy accessibility of these drugs and the frequency they are prescribed. Absolutely, they are prescribed way too often, Kim. In the church, we could offer links to those who are struggling with these addictions to support these folks, to help steer them in the right direction for help. So yes, that goes back to how we opened this session today, and making sure that we are supporting, that we recognize the signs, that we know the resources in our community. That's very key, Kim. She also says properly dispose of opioids when you are done using them. Absolutely. I don't know if many of you are aware, but there are drug take back boxes where you can drop your prescription drugs off to, it may be in your community, a local police station, it could be your local pharmacy, but to look for those drug take back boxes. We want to dispose of medication properly and responsibly. So we want to make sure that we do not flush them down the toilet or put them in our landfill, because we still have to drink this water. This is the only water we're ever going to have on earth, and we don't want it full of prescription drugs, right? So yes, that's very good, Kim. Carol says, educate ourselves and advocate, advocate, advocate. I don't think we can say those words enough. Educate, 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 and advocate, advocate, advocate are very important to fighting this pandemic. So it looks like someone's having issues seeing me. So Kim, if you could spotlight me, that would be great. Thank you. It looks like, Sarah, did you have something that you wanted to say? Did I miss that? Sarah Swears, if I pronounced that correctly.
I was asking if there's any studies going on that would improve pain control without opioids.
To my knowledge, there are a lot of studies that are going on, but the studies are typically not necessarily funded when it comes to going away from big pharmaceutical companies. So the studies that you are looking for are usually going to towards approving new drugs. And so, yes, there are plenty of studies that are going on when it comes to making sure that we understand how opioids can be addictive, but not necessarily other alternatives other than your current pain relievers that you're familiar with, your over-the-counter pain meds, as well as prescribed pain meds like naproxen or something of that sort. From there, Linda says, guard your drugs at home to preclude misuse by others who visit your home. That is a good point, Linda. And making sure that we do lock our medications up or put them in a place where no one has access to them, particularly if you have teens in your house. You want to make sure that your children or grandchildren are not accessing your drugs. Do not fill the entire prescription until you see if you really need it. That's a good point, Peggy. I try to do that as well when it comes to pain relievers, and that's an option for you, is to make sure that, you know what, I'm not going to fill the prescription until I absolutely need it. You have the prescription, you can take it to the pharmacy at any time, but if you don't need it, you may not need to fill it. Maybe your Tylenol or whatever your pain reliever of choice is enough. As I reported in the presentation, what we do know is individuals are prescribed stronger drugs but aren't reporting any change in their pain. So the same opioids that you are being prescribed could also, that same pain could be relieved with your over-the-counter medication. Now, that's not saying, again, that you don't ever need an opioid. Your pain tolerance is solely based on you as an individual. But if you find that, again, taking your over-the-counter pain reliever or not taking pain reliever and just getting up and exercising, doing some physical therapy or whatever that may be, is enough to reduce your pain based on your own tolerance, then that's the recommendation for you. Let's see. Jody says parents of student athletes need to actively question and manage prescribing of opioids to their children after injury. Jody, that is a great point. Again, I not even when talking about injuries, let's just think about going to your dentist. The last time you went to your dentist's office and you had anything, whether that was a filling or something of that sort, your dentist probably prescribed you an opioid. And the reality of it is that even with that 3-day or 5-day prescription of opioid pain medicine, many of us find that we don't even take the pain medicine. And so again, making sure that we are questioning and managing all the drugs that we are being prescribed by all of our doctors, including after injury for our children. And holding drug companies accountable for promoting opioids to be used. So as the opioid, I'll chime in on that, Judy, for that comment. As the opioid epidemic has, as it increased and more people became aware of it, we began cracking down on the makers of, for example, Oxycontin and Vicodin, because people were not aware of the risk of being addicted. So people were not aware of the risk of addiction, as well as holding drug companies responsible. Our legislators decided to hold doctors accountable. So policies and legislation has been written to make sure that doctors are not prescribing opioids to individuals who may be shopping. So that's when we found that when we put legislation on doctors, that individuals started shopping and trying to find multiple doctors to prescribe opioids to them. And so there are so many policies that have been put in place. And we're hoping again that these policies, we know that the policies are working, which is why again the use of heroin has begun to rise again as well, because these policies of opioid abuse have been put in place. Bernice says, what are done with the drugs when you turn them into different departments? They dispose of them. That's simply it. Now, I'm not sure how they dispose of them, but they are disposed of in a proper way. They are not going to be reused or flushed into our sewer system or anything of that sort. They will be disposed of properly. Judith says, poverty is a leading cause of drug selling. Is profitable and very tempting to young people trying to have money for their lives. That could be a reason, but there's also a demand. And so while people who are selling drugs, that is a problem, there's a problem that there's a demand for these drugs as well. So whether people are selling their prescribed drugs, so we don't just have to think about drug dealers. There are people who actually sell their prescription medications as well. So people who have obtained prescriptions legally who are now doing illegal things with them, or individuals who may, again, have taken their parents' or grandparents' prescription drugs and are selling them at school or to friends or to neighbors, whoever that may be. So there's a lot of different levels when it comes to individuals of how they access these drugs as well. Catherine says more rehabilitation services. Yes, the key to all of this is making sure that individuals have access to services so that we can make sure that addiction is not a problem within our community. So I'm reading the last comment. Providers are drug dispensers, big issue, not poverty, okay? Is now a law that providers must report to the state what is being dispensed and the number dispensed. Yes, so there is a comment where one of the policies someone was pointing out is that there is a law that providers must report to the state what is being dispensed and the number of prescriptions that are being dispensed as well. So again, that's going back to our doctors also being held accountable for what they are prescribing to individuals in our state. And then the last question that I have is, are methadone clinics a good way to treat addiction? And so that, Judith, is up to the individual. And so that's really a discussion between your doctor and your family and the individual. I don't want to say yes and I don't want to say no, because again, that is up to the individual preference and how they choose to deal with addiction. Okay. So I'm going to bring back up, oh, we have one more. Is it posted anywhere to the general public, all avenues of help? Deborah, that would be amazing if it were posted in one place, but I'm going to give you some ways that we can figure out how to help. So the first is in recognizing where you live. There are mental health agencies as well as coalitions in your area of how or who can help. So for example, if you live in the Midlands, you may be familiar with LRADAC, the Lexington and Richland County Alcohol and Drug Coalition. And so LRADAC is a place where you can go for an individual who may be experiencing substance use disorder. But again, in recognizing that an individual who is dealing with substance use disorder or opioid use disorder or alcohol use disorder, no matter what the disorder may be, and recognizing that it is a mental health problem. And so starting with your local Department of Mental Health is a great way. And if you don't know how to get in touch with your local Department of Mental Health, your primary care physician is also the first and best avenue that you can take. So this isn't necessarily you need to know the closest psychiatrist in your area, because I will be frank, South Carolina is a state that does not have a psychiatrist in every county. We are a rural county. We have a shortage of mental health professionals. And so it's not necessary that you see a psychiatrist or a therapist. What is necessary is that you do take the appropriate action and at least start with your primary care doctor. And if you do not have a primary care doctor, starting with your federally qualified health center in your area. So that is a key to individuals who do not have a medical home, as we call it. So a person that doesn't have a primary care doctor can start with your FQHC, which starts with your federally qualified health center. And every county has an FQHC. These are clinics that are funded federally for individuals who have health insurance or who do not have health insurance. And they offer medical services on a sliding fee scale. So they have everything from your primary care doctor to every doctor you can think of, as well as psychiatrists and therapists to deal with mental health. Okay, from there, I was started on narco. However, CVS didn't fill the script, but I didn't call my physician. I didn't call after my physician sent over the script.
Yes, this Vanessa Green.
Okay.
I was started on the narco. And when we went to the pharmacy to get my medication, they only gave me the ibuprofen. They did not give me the narco because they said I didn't ask for it. And so I didn't know the narco was sitting there. Yes. And I have a broken femur and a fractured knee. So I went without that pain medicine for several days. And then when I called the pharmacy back, well, the narco's sitting there, and they told me I have to ask for it after the pharmacy sent the script over.
I am not familiar with each individual pharmacy's protocol. I'm not familiar. I know typically when you have a narcotic prescribed to you, you do have to sign for it. So if you went in, they will ask you to sign for it. You have to present ID. Now, as far as why CVS requiring you to request it, I'm not familiar with CVS policies. I'm sorry. Okay, so Deborah says.
But I mean, a patient wouldn't know that. Okay.
Yes, ma'am. So I'm again, I can't speak for CVS and why they require you to request it. But once you brought it to their attention, they should have also given it to you. So have you gone back to get it?
Yes, they gave it to me. It's just that what I was going to say, how would a patient know that? That was my only thing. How would I have known that? No, go ahead. I was just throwing that out there.
Yes, ma'am. So I don't know. Again, I can't speak for that individual company and their policies of how they dispense their narcotics. But again, I do know that, oh, something's flying in my face. I do know that when it comes to narcotics, everyone is being held responsible for it. So whether it is the pharmaceutical company, whether it is the dispenser, whether it is your doctor, and the individual who is taking the medication, everyone has a role to play. And so that may be CVS's way of saying, hey, if you really want it, you'll ask for it. I can't speak for that. But that could be a policy that they have in place. I just don't know. I'm sorry. So Deborah says, mental health is so downplayed. I could not agree with you more, Deborah. I find those using this is often given a fast shuffle. Yes, so mental health, we know there are, of course, cases where individual is prescribed an opioid and then they become addicted to it because through no fault of their own. But we also know that a lot of individuals who abuse any drug has an underlying mental health condition. And so making sure that we are not downplaying the role of mental health when it comes to addiction is key. A question says, are methadone overdoses due to the use of opioids on top of legal methadone or illegal methadone use? All methadone. So it's not just illegal or legal use of methadone. It is all methadone. So people have individuals who are using methadone or any prescription pain reliever longer than they should be, past their prescribed pain management, has the risk of overdosing. Martha says, what if it is a family member that has the issue but does not want to get help due to HIPAA law? The family member is not able to talk to the doctor on behalf of the family member. Martha, I have a solution to your question, so hold tight with that. I'm gonna bring it up in just 1 second. I'm gonna answer Patricia, and then I'm gonna come back to you. So Patricia says, in Denton County, we have Tri-County Mental Health and Trinity Behavior. Yes, you do. These facilities receive referrals from DSS and PD Coalition and physicians. Yes, Patricia, good job on knowing the resources in your area. Every county has some type of mental health solution. Again, whether that is your local Department of Mental Health, or if you live in, say, Spartanburg County, you have the Forrester Center. If you live in Greenville County, you have the Phoenix Center or the Piedmont Mental Health Center. There are so many options throughout the state of South Carolina. So just knowing your local resources can be very important. But to answer Martha's question, what if the person does not want help? Recognizing that our role is to support and encourage and to help individuals who maybe, I'm going to bring back up my presentation. So to make sure that we recognize that individuals who may be experiencing substance use disorder is likely experiencing a mental health crisis. So I'm going to bring this up. And so when we talk about that, I do have a solution for another training, but I want to get through this first to honor you all's time, and then I'm going to go back to Martha's question. So how do we prevent overdose death? The majority of the overdose deaths are on prescription or illicit opioids, okay? And so exposure for individuals who are taking more than one drug at a time increases their risk for overdose. And as we have all said, we have a role to play, whether that is learning the risk of opioids, whether that is learning about naloxone, which also is called Narcan. So you all may have heard of Narcan and its availability and how to use it. And so with Narcan, it simply is just used to counter the decreased breathing in opioid overdose. So essentially, as a person may be overdosing on an opioid and they begin to decrease in breathing, the Narcan or the naloxone can counter that in making sure that we have time to get that person to the hospital. So that is something that is available, as well as helping people struggling with opioid use disorder find the right treatment center. So we had that discussion in the Q&A that we just went through. And again, recognizing that not all doses have to end in death, okay? So we want to make sure that we are educated enough to help individuals. And here is one of the ways that we can help. For Martha's question about what do we do when we can't violate HIPAA laws and, go and talk to that person's doctor about their issues, we have resources in our community that are available, like SC Hopes, which is a new resource that is available. It is a partnership. And so making sure that mental health and addiction support is available. It is 24 hours a day. I will say this is not a crisis line though. So this is for individuals who are looking for mental health support and addiction help. But this is not a crisis line. So if you have someone who is actively in crisis, you may want to consider calling 911 or finding a crisis center or a team that is available in your area. But to keep in mind that SC Hopes is a great resource for our community in letting people know that they are not alone. Individuals are here to listen, provide resources, and to connect them to treatment. Some other things that we can do within our community is educate our church members. If you are not a part of the Hold Out the Lifeline bulletin inserts, I'm going to give you some information at the end of this presentation of how you can start receiving bulletin inserts or information graphics if you have not yet gone back to church because of COVID. We provide inserts for you to share information about opioid abuse and other prescription COVID and different pandemic information. And so again, making sure that you are providing the information to our church members, as well as recognizing that there are national resources. So you have the Center for Disease Control, the CDC. They have information that is available to you that you can order and again, share with your congregation. And then most important of all, here is the final story that I want to share with you. And a piece of this also answers Martha's question about what can you do when a person doesn't want to receive help.
Jamie was always given the toughest kids because he was the only coach who could get through to them. No matter how busy he was, teaching and coaching, he always made time for our family adventures. He was a great listener, and he told you the truth, even if it was hard to take. If you're thinking, my kid would never do heroin, our home is safe, an overdose could never happen here. So did we.
So again, knowing the signs, Martha's question, and recognizing that someone may need help, the first thing that you can do is exactly what Martha pointed out, is in recognizing the signs that a person is struggling with some type of addiction. And so once you know the signs, knowing how to act and knowing the resources in your area are key. And so learn the actions and be a lifeline. And how you can do that is actually by attending a course that is free to you called Mental Health First Aid. This is a 8-hour certification course that teaches you to know the signs and symptoms of not only addiction when it comes to substance use disorder, but depression, anxiety, and even signs and symptoms of psychosis. It teaches you how to act, how to respond, how to be supportive, and how to encourage that person to receive the appropriate help that is needed, whether that is going to see a doctor or even if that's self-help, whether that's just using cognitive-based therapy or something non-related to that, exercise and support groups and going to church. So again, using your faith as a way to help individuals, or their faith as a way to help individuals through a crisis. So if you are interested, you have an opportunity to actually go through this training this upcoming Monday and Tuesday, February 22nd and 23rd. I want to encourage you to go to the Hold Out the Lifeline website and register if you are interested, or to even learn more about the course itself. This course is offered through the National Council of Behavioral Health, as well as in partnership with Hold Out the Lifeline and DHEC. So there are a lot of people who are supporting this course, and I would definitely encourage you, if you want to have those conversations and figure out how to get people help, or even just recognize the signs that someone is in crisis and struggling with a mental health disorder, then this is a course that I would recommend for you. It is free to you. Again, you can visit holdoutthelifeline.org. So here are the next steps before we go into our final question and answer. Share the good news. Your voice is needed. We've talked about it. Education, awareness, advocacy, promotion, all of these things are key for healthy communities and for healthy people. So again, share what you have learned today. So finally, if you are interested in receiving those bulletins, if you're interested in learning more about what Hold Out the Lifeline is doing and how you can be a part of it, reach out to Dolores Scott. She is the executive director of Hold Out the Lifeline. You can contact her at scottdb@hotlifeline.org, or you can simply just go to the holdoutthelifeline.org website, or visit us on social media at Facebook or Twitter, which is Hot Lifeline, to get more information about us or to ask questions. So I now want to make sure that I have addressed all questions. And Wendy, I am going to open it up to you. I see a lot of things have popped up.
Yeah, I see. One, I had a biopsy and they prescribed a painkiller by my request, which was tramadol. Got about 7 tablets, but only needed to take 1. So obviously, see if we have any other questions out here. Oh, okay. It says the prisons are full of addicts and mental health individuals because of the pandemic. The courts are open to citizens through a WebEx. Well, let me see. Let me see. Where did I lost that one? Sorry. There we go. Portal where we can sign in on and watch. And
wow. So yes, what we have noticed as we have defunded our mental health system, our jails are being overrun. Our jails and our hospitals, emergency rooms in particular, are being overrun with individuals who may be experiencing mental health issues.
okay, I'm looking to see if we have. Fortunately, mine dropped here. I apologize for that.
Okay, I do see where it says, Deborah says, I have family members diagnosed with mental health issues, and yet the state government says they no longer need any assistance since they are trying to get an advanced degree. Why are they insensitive when they try to better themselves? Deborah, that is a question that I wish I had an answer for. I don't think many people recognize that mental illness is not based on your socioeconomic status. It doesn't matter whether you're rich or poor, Black or white, male or female, Christian or non-Christian. Mental health is an issue for many people. Statistics show us that 1 in 5 individuals in the US are diagnosed with a mental illness any given year. 1 in 5, that's 20%. So if you even look at our screen, you can do the number. 1 person in each row, if there's 5, could potentially have been diagnosed with mental illness in any given year. And we're everyday hardworking citizens, and it doesn't have to be because of drugs. From
I see
there,
one here. Yeah.
okay.
And this is tying into last week's presentation. We must learn to be advocates for the elderly, as they are often not aware of the medications and are given large numbers when they really don't need them.
That is so true. And so advocating and actually having a conversation with the senior. In my experience of working with seniors, which is something that I have, I've worked with seniors, particularly on educating them about their doctors. And seniors sometimes have a mentality of, my doctor said so, so I'm gonna do it.
Mm-hmm.
And that's not necessarily the way it should be. Seniors don't recognize that they are the final say in their health care, and that they matter when it comes to how their health care goes. So again, making sure that they understand that they can ask their doctor questions, they can question their doctor's thoughts and say, you know what, maybe this isn't what I need, and get a second opinion. Many seniors do not know, particularly on fixed income, if you're on Medicare, Medicare pays for second opinions. So you don't have to, if you're not agreeing with what your doctor is saying, you can get a second opinion and it will be paid for by Medicare. So that is definitely key in making sure that you are having conversations with your loved ones about their medications and if they're actually needed. I know, for example, my grandmother, her doctor prescribes her monthly Tylenol for arthritis, the arthritis pain reliever Tylenol, a month supply every month, 3 times a day. That's a lot of Tylenol, and it seems to be an indefinite prescription. And so who knows the consequences of what or how long you can take Tylenol before it starts to have issues with your gastrointestinal, you know, so there are so many consequences, and just making sure that your reward outweighs the risk of what you are doing. And so we're learning about that even in the pandemic as we talk about vaccines, right? Is the reward greater than the risk? And for many people, it absolutely is. The reward is by far greater than the risk. And so making sure that we're doing the same with our medication is important. Any other questions?
Don't see any others that have come in, but
wow. So we are right at 1 hour.
I want to take the opportunity to thank you. It was a pleasure speaking with you yesterday. And you mentioned that this was your passion. This is certainly evident through your presentation today. There's a lot of good information for us. And again, I appreciate your time. We didn't expect when we initially we would be speaking with you from Africa. I think that's amazing. And again, we thank you very much.
Yes, thank you. And so I hope to see all of you all when I get back to the United States. Look, Kathy says, what time is it in Africa? It is currently 9 p.m. in Africa. I am 6 hours ahead of you.
Tori, thank you. That was wonderful. So much education. I'm a teacher and I was taking lots of notes.
Oh, wonderful. Thank you so much. I hope to get invited next year. Maybe I'll have something different to talk about next year.
Well, again, thank you so very much. Like I say, yesterday you mentioned that this was your passion. That's certainly very evident, and we appreciate it.
Thank you.
Okay, I think our next, I'm going to take the opportunity to thank all of today's participants and everyone who joined us for the afternoon's program. I also appreciate those that were participating in the chat and had questions for Tori. We have two reminders. The videos of these programs will be available at the conclusion of the series on our website. Our next program will be on Saturday, February 27th, beginning at 10 a.m. And our workshop leader that day will be Jessica Brody, who will present Jesus, Justice in Action, and United Methodist. So our closing prayer this afternoon will be offered by Maureen Thomas. Maureen is a member of Centenary United Methodist Church in Hartsville and serves as the president of Centenary's UMW. She's a former South Carolina Conference UMW treasurer and now serves as a Conference UMW Legacy Liaison, joyfully serving women, children, and youth. Thank you, Maureen, for sharing with us today.
Good afternoon. Let us pray. Heavenly Father, we thank you for every person that has filled this virtual room this afternoon. Thank you for all the hearts that have been present to hear and learn what it is about opioids and the drugs addictions that are out there. Only you truly know what we were setting out to accomplish today. We had ideas, a vision, hints, and daily instructions. We have talents and abilities and time to work. However, only you can see in perfect detail the end of every beginning, every project, every season, every life. Nothing is ever in vain, for even missteps are used for good. We started this meeting with you, and we're closing it with you. Thank you for making this meeting a success. We would not have done it without your presence, because many of us, our plans are not what they turn out to be, but they are given in your name. We know that all is well. With the things we have learned today, stir our hearts, and may we put them into action. May those things that we've learned impact our lives, families, friends, and the rest of the world positively. In Jesus' name we pray. We believe in this. We pray. Amen.
Amen. Amen.
Thank you, Maureen. Okay, I believe that concludes this segment. Like I say, next, the 27th will be our final, and we look forward to everybody attending with us then. Thank you.
All right.